Hello everybody, Dr. Parsa Karimi coming at you from our Plainview location, PKL Physical Therapy. So today we're going to talk about the benefits of myofascial release, or deep tissue massage. It's part of the manual work that physical therapists should be doing, but many physical therapists are not doing. Now we're in Plainview and we have another office in AMITYVILLE, and I can't tell you how many patients I've had that have come from surrounding physical therapy practices that do not do this at all. And I find this out based on the fact that when patients are getting the massage here, and these are patients that have gone to 3, 4, 5 different physical therapy places over the course of their lifetime, and they've never gotten a deep tissue massage. And they often say, what is this? What are you doing here? And I say, this is deep tissue massage. You haven't gotten this before in your previous experiences? Nope, never. You know, they just basically, they rub the skin a little bit and they just move my knee and that's pretty much it. So that's very disheartening to hear as a physical therapist. I don't blame the other physical therapists that are out there. I know the PT school that I went to, we did 1 day in massage therapy, and that was basically a massage therapist came in and taught us how to do the nice Swedish massage and nice skin rolls, and that's about it. So I don't blame him for not doing it, but it's really incumbent upon you as a physical therapist that once you come out to really seek the best ways to get your patients better. And the best way, one of the best ways, if, you know, obviously you need exercises, we have all this equipment here, you need the exercises to right and correct any kind of muscle imbalances, any kind of weaknesses, lack of flexibility, and so on. But you have to couple that with a deep tissue massage. And one of my other videos I did was the treatment trifecta, which is the deep tissue massage, the stretching, and the targeted exercises. So today, though, we're going to talk about the benefits of myofascial release. Myo pertains to muscle. Like if you ever hear of myocardial infarction, myo is muscle, cardio is cardiac muscle, and infarction means death of. So there's death of cardiac muscle. So myo is muscle. Fascial is fascia. It's the white, sheathy connective tissue that's around the muscles that helps keep everything in place. If you've ever cut open chicken or steak and you're about to prepare it, and you see that white sheath, that's fascia. It's when that gets bound down and restricted, that's when most of the problems happen. That's when most of the pain occurs. And people never bring that back to being the muscle as the source. They usually point to the joint that muscle crosses or attaches to as a source because that's where their pain is. So I'll give you an example. Best example I can give you is, and this happens all over the body, we can go through numerous parts, and I'll give you several actually. So the knee, the front thigh muscle is the quadricep muscle. Now that quadricep muscle starts up at the hip and the top of the femur, right? One of them crosses the hip, the other 3 attach at the top of the femur. And that's why it's called quad. So altogether, there's 4 muscle bellies. All those muscles come down, they converge to one thick tendon. Tendon attaches muscle to bone. You cannot take a muscle and just attach it to bone by itself. It's like taking a piece of steak, and because that's what steak is, it's muscle, and trying to sew it onto a piece of wood. And as soon as you pull on that steak or the muscle contracts, it's going to just rip off because there's no anchor there. The anchor that needs to be attaching the muscle to that bone is the tendon. And in the example I was giving you, piece of steak is the muscle, the piece of wood is bone. So the quadricep muscles converge down, they form one thick tendon, which is about this thick, and that attaches to your kneecap, and your kneecap is a sesamoid bone, meaning if you cut the tendon from the top, and then you cut the tendon from the bottom, it would just fall off. That tendon is just there, that patella rather, is just there to get the biomechanics of the knee function so it can, you know, lock out and straighten out and bend. Without that, your tibia and femur would just kind of hit each other. In any case, if that tendon starts to become very, very tight, it's going to take that patella, and if this is the femoral groove, like this is the groove where your patella this is your patella, this is your femoral groove, and it just kind of moves back and forth. If you ever have your knee completely straight and your quadricep is relaxed, you can take your kneecap and wiggle it around. That's supposed to happen. That's the open pack position, meaning the bones are in least congruency with each other. So if you can start moving around, that's good. But if the quadricep muscle comes down, right, attaches to the tendon wraps around the kneecap, and then from there it attaches to your tibia, your shin bone. If that muscle is very, very, very inflamed, it's going to tighten up. If that tightens up here in the front thigh muscle, it's going to cause the tendon and the kneecap to be very, very tight, obviously. Not the kneecap, but the tendon's going to be very, very tight, and it's going to take that kneecap and drive it. So instead of being moving around like this with a little bit of space here, it's going to be like this, and it's going to be grinding like this every time you use it. When do you use it? Stairs, walking, squatting, all those things are going to irritate you. So if you have any of that stuff at home and you're feeling, hey, I don't know how the hell my knee started bothering me, but it hurts with those activities, especially stairs, squatting, and just walking, then it's probably just a simple quadricep strain. Be careful, because they'll tell you, oh, you have bone-on-bone arthritis, let's do a total knee replacement. Please don't do that. Always seek a physical therapist advice first. Seek an evaluation. You don't need a prescription other than if you have Medicare, no fault or workers' comp. That's on a side note. So if that quadricep muscle is very, very tight, it's going to take your kneecap by way of the tension in the muscle, by way of pulling on the tendon, and by way of taking that bone and jamming it down, causing arthritis. Arth pertains to joint surface. Itis is inflammation of. So bursitis, inflammation of the bursa. Tendinitis, inflammation of the tendon. Arthritis, inflammation of the joint surface. But what causes that temporary, I call it, arthritis, is the fact that your kneecap is being ground down into the femur because, not because you're getting older, not because you're gaining weight, not because, anything else. It's because that muscle is inflamed, forcing that to happen. Another example is, and so you get pain right at the knee. How you fix that, I'll explain it later. Another example is, let's say, the upper extremity. People get tennis elbow, and they say, I don't even play tennis. What the hell, had this happen? Tennis elbow is, you have wrist extensors, which are all these muscles here. You can actually see the tendons wiggling around if you ever do this to your fingers. They all attach right here, called the lateral epicondyle of the distal or the end of the humerus. They attach from here and they traverse. Now, from here to here is muscle. Right around here, it starts to turn into tendon, and tendons flare out and they attach to the tips of your fingers. Tendons are the long strings. Remember, I said the only way you can anchor muscle to bone is by way of tendon. So the moment you contract this muscle, your wrist extensors, you want to do extension of the wrist. So the moment you do that, it pulls this tendon here, because we have to attach it here, and this tendon's here. So the muscles contract, pull on the tendons, they pull on the bones, and they give you the desired movement of what you want. You want to bring your hand up this much, it'll give you that much contraction. Whatever. You have the same thing on the other side, your wrist flexors. They attach from here, muscle from here to here, right around here starts turning into tendon, attaches to the tips of your fingers, and then you could squeeze your hand. Okay, now, when these muscles in here become inflamed, and by the way, they'll never give you pain here. You'll never feel it here. You either feel it at the wrist, more commonly with tennis elbow, of course, you feel it at the elbow. So this muscle is inflamed, it pulls excessively. And what it does is it wants to pull, literally feels like it's pulling this tendon off the bone. Tendons are very sensitive to pressure, to touch, to tension. So when it's trying to pull this off the bone, you're gonna have a lot of pain. With what activities? Simple things. Driving, picking things up, maneuvering things, turning a door handle. Anything that is just so basic and common that we just do without even thinking about it, you're using your wrist extensors to do that. So if those muscles are inflamed, it's going to pull a lot on the tendon, give you a lot of pain, and then you're going to start to say, what's going on with my elbow? People go and they have surgery here, injections here. All you need to do is the following: myofascial release. And you're not going to do that. You need a skilled professional to do that, because you have to know what pressure to apply, what not to apply, and things like that. So, what is myofascial release? It's the release of the metabolic waste deposits and adhesions that have built up into that muscle, causing it to go from a nice smooth muscle fiber to a contracted one. Because as soon as it's nice and smooth, you got to picture my fingers are going to keep going and attach to something by way of tendon. And the moment I do this, it's going to pull on this tendon and get inflammation and irritation on that tendon. And it's going to cause pain at the joint. And again, many people go and have surgeries at these joints because when they do have pain and they go and have an MRI or an X-ray or something, those things show, oh, look, you have a meniscus tear in the knee. Oh, look, you have arthritis at the hip. Whatever it is, those simple examples I gave you at the elbow and at the knee, they're all over the place in your body. Anywhere you have a muscle attaching to bone, you have a chance of that muscle becoming inflamed, pulling on its tendon, giving pain at that joint. And it'll be painful with certain activities, depending on what the body part is, depending on what muscle fibers are recruited to do whatever activities you need to do at home. The most basic things it could bother you with. So, when you go to a physical therapist, we evaluate you, we want to see, okay, what's causing your pain? And what we'll do is, we'll test you and say, okay, does this bother you? Does that bother you? Does it hurt with this activity, with that activity? And we'll determine based on what you're telling us what muscle it is. Then we'll go and we'll palpate, which basically means we'll feel around. And our fingertips, we've trained them that over the years, we could feel when a muscle feels restricted, which just feels tight in there. And then at the same time, you'll say, ow, yeah, that hurts, that's bruised. Why does it hurt there? It hurts here because this is what's causing your pain here. So what we'll do is we'll do a deep tissue massage here. We'll dive down past the skin, so your skin is here, you have subdermal tissue and fat here, then you have your muscle here. We have to go deep to that. People sometimes will get bruising afterwards, sometimes you won't. but you'll feel like it's bruised because, yeah, I just dug my thumb into it, but I have to get down to this level. This is the area that's causing the pain. Anybody who gives you a nice foo-foo, nicey nice massage and you're talking and, this happened this weekend, oh, it was wonderful, that's a waste of time. If you're getting that, you are getting a waste of time. You can do this at home. You have one of your family members massage you for crying out loud. You need somebody to get down into that muscle, know how much pressure to give. What I always tell my patients is, we should be uncomfortable but tolerable. We should be having a little bit of a discussion, but sometimes the person literally will stop talking in the middle of it, and they'll be like, oh, so anyway, oh yeah, that's the spot right there. Oh yeah, that's it. That's what you should feel. A little bit of a grimace on your face, and everybody says, this massage hurts so good because I feel like you're doing something. You're getting into the muscle, and what we're doing is we're breaking up all those adhesions that are in the muscle belly. All that restriction that's in there, we're literally getting in there mechanically and just breaking it up, saying loosen up, loosen up, loosen up. And as it loosens up, your lymphatic system, which is the vacuum of your body, basically drains all that debris out of you. That's why if you ever go to have a massage, they always give you a little bottle of water afterwards and say, here you go. Why do they give you water? Because they're trying to stimulate you going to the bathroom so you can get all that debris out of your system that they broke up. If they go light, then they really didn't break up much, maybe a little bit, but if they go deeper, they really break up a lot of inflammation within that muscle, and that's what you want. So that's what we do with a myofascial release. Depending on whatever body part it is, whatever muscle it is, there are over 600 muscles in the body, and just remember that if any muscle goes into spasm and goes into a big strain, it is going to pull excessively on the tendon, give you a lot of pain at whatever joint that you're having problems with, and most of the time, it's a simple myofascial release. And then you gotta say, okay, what caused that? What caused that muscle to become inflamed? Because that's the most important thing. As a good PT, you always ask yourself, well, what caused that? Okay, well, what caused that? Okay, well, what caused that? Until you just finally say, I don't know what caused it, but these are my impairments, these are what's limited, and now let's go fix it. What a muscle that's inflamed and strained will do, A, like I said, pull excessively on the tendon. B, anywhere that muscle has that gunk in it, muscle can't create force for you. That's what muscle does. That's all it's used for. It creates force to do whatever you need it to do. If you have a muscle that's this big, and this much of the muscle is bound down with that gunk, that metabolic waste and adhesions, you are, whatever this percentage is of the muscle, weaker. So let's say this is 25% of the muscle. You're that much weaker in that muscle. Okay, you might say, well, I'm not a power lifter, what do I care? Well, you're trying to climb stairs, right? Now you're a little bit weaker at that knee. Now you're a little bit weaker at that elbow. You also have pain when you activate or use that muscle, so you're gonna start to disuse it. You're gonna say, you know what, it hurts when I do this, I'm not gonna do it. Now you start to have a cascading effect of, if you're not using it, you start to lose it. You're getting weaker because you're not using it, and now you're using it even less because you're weaker. So it's just like a vicious cycle that just keeps going. You lose flexibility, like I said, because it pulls on the tendon. You lose strength, like I said, because it's part of the muscle's gunked up. You have increased pain. You have increased inflammation and swelling. And overall, your functional level goes down. What do I mean by functional level? Like I said before, if it hurts to use this hand to turn a key, to whisk an egg in the bowl, to lift something, anything like that, that's a functional activity. If you stop doing that because it hurts, you're going to start to decline in function at this upper extremity. You're going to start, decline here, but yeah, you're declining at your shoulder, at your scapular muscles. Everything is being affected because you're not using this hand anymore, and then you're going to start to get the whole upper extremity being painful. And I've had people that come in here with neck pain, and I realize their entire scapular region, their whole shoulder girdle is very, very weak, and I find out, oh yeah, months ago I had a lot of pain here, I got an injection, it slowly got better, but it still bothers me. Well, this is the causative factor. This led you to not use your arm, this led you to get this weaker because you weren't using your arm, you lose it, you use it, you lose it, and then now you have neck pain because of it. So these are all the things that a physical therapist, a very good physical therapist, should be able to look at. And just because you come in with like elbow or wrist pain, they should look at the entire history of what may have caused that. So when a muscle, as soon as you do a deep tissue massage, you break up the inflammation and you break up the adhesions. And it's not all going to go away in one day. I've had patients that are coming in and maybe they need like 3 or 4 muscles that need that deep tissue massage. And over the course of the few weeks that they're coming in, it goes down to like one muscle, and then at the end, that one muscle feels so much better. They say, hey, it only hurts when you guys massage me. My functional level's up here, my pain is down here. It really doesn't bother me as much. At the same time, their exercises in here have been progressing to get harder and harder and harder, and they're very oftentimes stronger than they were before they ever came to therapy. And they're delighted about that. And I say, look, off you go. We do personal training here where you can come in, we teach you how to exercise, and we say, off you go, get your butt to a gym and continue to exercise, not just with walking, with weightlifting. Another video I'll do about that. Weightlifting is the most important thing you can do. Now, I'm not talking about Arnold Schwarzenegger, Lou Ferrigno type weightlifting, lifting all this weight, but you're lifting weights and you're getting stronger. So, I've had patients where I've muscle tested them, and there's different grades of muscle testing. So a 5 out of 5 is as strong as you can be. A 0 is basically, or 1 is like a trace, basically like a twitch in the muscle, that's it. I've had patients where they've come in and I've muscle tested them, they were like at a 3+. And I do the deep tissue massage, break up some of the inflammation in that muscle, I stretch it, and then I re-muscle test them, and they're stronger. They're like at a 4. Why are they stronger? Because remember, I said this much of the muscle and this much of it is inflamed and it's bound down with inflammation and gunk, and it's 25% weaker. We massage it, we stretch it. Now all of a sudden we gave this much back to the muscle. So more muscle fibers, more motor units, everything else you have more soldiers in the fight that can create that force for you. And now you're a little bit stronger because you're using more muscle fibers. Okay, again, who cares? Now you're using more muscle fibers. You might be able to climb the stairs easier. You might be able to lift that object with greater ease and less pain. You'll start to reverse that disuse atrophy because you're getting stronger, and you'll say, hey, you know what, I want to use this arm. Then this gets stronger, everything gets stronger, less chance of any kind of potential future ailments that you might have. Your flexibility is obviously going to improve because a muscle that's bound down like this and very, very tight, the moment we start massaging it and gaining more flexibility, the muscle is going to be able to stretch more. At the same time, it'll have less tension on the tendon because if it's more flexible, it's not going to pull as hard on the tendon. And then voila, your pain goes down. And that's what mostly people come in here for physical therapy for, is I have pain here. I don't know how it happened, which is 70% of the time when people walk in here. And I love that diagnosis because it means it's a biomechanical issue. I have to figure out, well, what led to this patient's pain? What led to them not being able to do such and such? And then we kind of reverse it, and then we find out, okay, that's inflamed, that's weak, that's tight. Let's design a treatment plan to correct all those things. So that's tight and inflamed, deep tissue massage. That's very, very tight, tight and lack of flexibility. Let's just stretch it. That's very, very weak. Let's strengthen it. And it's all targeted stuff. And every few sessions when you come in, we kind of reevaluate you, like little mini reevaluations to see how you're doing. If you say, hey, I've had 3-4 sessions here, I feel like 40-50% better, that's awesome. Obviously, we're going to continue with what you're doing. We're going to look at your weights and exercises and say, you know what, you've been doing this exercise, it's getting easier, or the weights are going up to a certain point. Now there's a harder exercise that we can graduate you to and get you to do that one. Now we don't need to do this easier one, let's get you to do that harder one. The more harder exercises you do, the more functionally independent you're going to be, especially you seniors. Do not think for a second that weight training is not for you. If there's any group in this world that weight training should be mandated to be done, is the senior citizens over the age of 60 years old. You must be lifting weights. You are going to lose 10% of your muscle mass every single year, and it's a decline because you lose muscle mass, you lose strength. You lose strength, you lose functional independence. So the only way to reverse that is by weight training. It goes back up. That's why you see people in their 90s doing yoga, running marathons. They're not aliens. They're just people that took control of their lives. They stopped being lazy. They stopped listening to medical professionals that are telling them it's just old age. No, it's not old age. Reverse it, get your butt to a gym. But again, myofascial release, if you're not getting it where you're going for physical therapy, and then if you ask, hey, can you do some massage? And they give you one of these little things where it really feels like you're doing it yourself, get out. Stop wasting your time. Stop wasting your co-payment dollars. Healthcare is at an all-time high in terms of cost. If you're going somewhere, make sure it's effective. Again, we do the treatment trifecta. We find out exactly what's tight, we stretch it. We find out exactly what's inflamed, we massage it. We find out exactly what's weak, we strengthen it. All those things together. It's like baking a cake. You can't do it without certain ingredients. You need all three of those things together. And then that's how it all comes together. That's how the person leaves here better than they came in. So again, myofascial release, very, very important. It increases your flexibility, increases your strength, decreases your pain, and overall, most importantly, it increases your functional independence and activity level and capacity, so you're able to do more. If you have any other questions, please give us a call. Our website and phone numbers are listed. We're in Amityville and Plainview, Long Island, New York, and hope to see you soon. And just remember, you do not need a prescription to start physical therapy. If you are a senior citizen or are on Medicare, you do need a prescription. And for that, I would just say, go to your primary care doctor. Say, listen, nothing's broken, nothing's torn. I didn't fall down the stairs. The bone's not sticking out of my skin. It's not an emergency. I'm having pain here. Can you send me a physical therapist? Any physical therapist that's worth a salt. We graduate with our doctorate now. So, and for the last 20 years, we've been graduating with our doctorate degrees. The last year or so of that, of the education process to get your doctorate, it's called differential diagnosis, which basically means when physical therapy is indicated and when it's not. So if somebody's coming in and they say, hey, you know what, I'm having pain down my arm, I'm sweating, I feel like there's an elephant sitting on my chest, I'm not going to think it's a shoulder issue. You're probably having a heart attack. So that's when we know to say, hey, PT is not indicated right now. Go see an orthopedist, go see a neurologist, go to the ER. All those kind of things are what we learn when we're in physical therapy school. So if you ever have any issues, and like I said, 70% of the time when people come in here, it's, I don't know how the hell it happened, it just started bothering me. So that is a perfect example of when physical therapy is indicated. Have a great day. Hope to see you soon.